KMT2B Dystonia, A Twisting Road by Tara Taylor. What is dystonia? Dystonia is a neurological movement disorder. It affects voluntary muscles. Dystonia is the third most common movement disorder. More than 300,000 people are diagnosed in North America with dystonia. It is more common than muscular dystrophy, Huntington's disease, and ALS disease combined. Traffic jam. Dystonia causes a traffic jam in your muscles by sending too many signals at the same time. Dystonia makes muscles move and twist. It can also make muscles stiff and tight. Dystonia can make it hard to walk, write, speak, and sit still. How is the body affected by dystonia? Dystonia may affect a specific part of the body or many parts simultaneously. This is a picture of the different body parts that can be affected by dystonia. Dystonia can either affect one part of the body, or segmental dystonia has multiple parts of the body. Who is affected by dystonia and at what age? Men, women, and children of all ages and backgrounds are affected. At the age which the symptoms begin often influences the prognosis and the treatment. What causes dystonia? There are many causes. It may be inherited, a new genetic mutation. Dystonia changes the brain activity caused by other health conditions. It's result in an injury to the brain or nervous system, or certain drugs may also cause dystonia. However, for many people who develop dystonia, there is no identifiable cause. What is KMT2B dystonia? KMT2B dystonia is a newly identified genetic dystonia syndrome. It was first described in 2016. It is a complex childhood onset neurological movement disorder. Onset of the disorder typically occurs between the age of 1 and 10 years old. The muscle spasms make it difficult for the individual to move his or her body and difficult to control his or her body movements. Generalized dystonia becomes evident in most individuals within 2 to 11 years of onset. The level of gross motor disability ranges from minor gait disturbances to wheelchair dependency. What are the signs and symptoms of KMT2 dystonia? Involuntary muscle contractions. It may involve the lower limbs. It usually starts in the lower limbs and then turns into more of a generalized dystonia. KMT2B also makes it difficult for the individual to communicate, difficult for swallowing, and the symptoms worsen with stress, fatigue, or anxiety. How is KMT2B dystonia diagnosed? At this time, there is no single test to confirm the diagnosis of it. Dystonia results differed from each individual. However, diagnosing it, the neurologists observe the symptoms. They get patient history, family history. They do laboratory tests such as blood, urine, spinal fluid. They also have EEGs and genetic testing. All those help diagnose KMT2B dystonia. This is actually my son, and this is one of the tests that they did with him recently at Cincinnati Children's Hospital. They monitor and record every time to see the progression. What treatments are available for KMT2B dystonia? Well, there's many different treatments, and the treatments vary depending on the individual. So everything with KMT2B dystonia is very individualized. There's a combination of oral medications that you can take. There's also Botox therapy. There's deep brain stimulators. And then also with those, most individuals have to have physical therapy, speech therapy, occupational therapy, and some also need emotional and psychological therapy. Botulism neurotoxin therapy is Botox, And what they do is they actually inject the Botox into the muscle, and that allows a blockage to stop the chemicals being released that are activating the muscle contraction. So it actually helps calm the legs or arms, whatever part of the body that the patient needs. What is the cure for KMT2B dystonia? At this time, there is currently no cure for KMT2B dystonia. There are only treatments available. What is the prognosis for KMT2B dystonia? Well, it's a chronic disorder, and the progression is very difficult to predict. It depends on the individual, and that's why neurologists are constantly monitoring the individual to see the pattern and how the individual deals with things on a daily life. It impacts their mental health. It may shorten the person's lifespan, and there is a chance of passing mutated genes onto their children. This is my son, and this kind of tells you.
Go first! Okay,
That was Carter.
Go first!
When he was younger. As you can see, he had wonderful running abilities. This is Carter as he aged and the progression set in. He has difficulty walking with a smooth gait. It's awful and clumsy. However, many patients that have dystonia have learned to compromise, and that's absolutely what my son has done. And this is Carter golfing. As you can see, it's not going to be a normal golf stance or follow through, but the stroke is absolutely beautiful. With dystonia, there are many twists in the road. Twists that, as a parent, are extremely difficult. However, we take each day and continue on with our lives. These are some of the things that Carter has recently had. They do swallow testing every so often to make sure that everything is working well with the swallowing aspect and that there's no aspiration. They check his thyroid. They check his vitamin D levels, and then Carter is on baclofen, carbilevodopa, and penicillin. He also has clonazepam, but that is just if he has more of a dystonic storm. In life, no one is guaranteed tomorrow, so make sure you make memories and enjoy each day.